All right, welcome to this briefing. We're going to dive into how surgery today is getting way smarter, not just, sharper. We're going to look at some wild ideas, like when a bigger surgery is actually the safer option, how one simple measurement can stop huge complications before they start, and get this, 3D printing that happens inside the human body. Let's jump right in.
Now, before we get started, I want to be clear that this entire briefing is built on a really sharp review by Dr. Reza Lankarani. He's a general surgeon, the founder of the Surgical Pioneering newsletter and podcast series, and he's on the editorial board for the Genesis Journal of Surgery and Medicine. So what you're about to hear is a curated look at what's genuinely pushing the envelope in surgery right now.
So let's ask the big question. In a field that moves so fast, what really defines the cutting edge of surgery? Is it just about smaller incisions or fancier robots, or is it something deeper? We're about to break down 3 incredible innovations that show the real frontier isn't just about better tools. It's about making smarter, data-driven decisions. Okay, first up, we've got a fascinating paradox. We're talking about a surgical dilemma where that old saying, less is more, gets completely flipped on its head. Let's talk about the thymus gamble. So put yourself in the OR for a second. A surgeon spots a tumor on the thymus gland. Now they have a choice, a really critical one. Do they go for a smaller, less invasive procedure, or do they opt for a much bigger, more extensive one? Your gut might tell you one thing, but that could be the wrong answer. And believe me, the stakes are as high as they get. And here's why that choice is so tough. This is the core of the problem, right here. A major study found that in almost 80% of cases, that's a staggering number. Tumors that looked small and contained on scans, well, they turned out to be way more advanced once the surgeon actually got in there. We're talking about a huge margin of error before the first incision is even made. Okay, so with all that uncertainty, you're left with 2 very different options. On one hand, you've got the partial thymectomy, where you just remove the visible tumor. It feels like the right call, right? Less invasive, more conservative. But on the other hand, you have the total thymectomy, where the entire gland comes out. That's the gold standard if you know you're dealing with cancer. So with an 80% chance that the scans are underestimating the problem, which path do you take? Which one is actually safer? Well, the data speaks for itself, and honestly, it's jaw-dropping. Researchers looked at the outcomes and wow, the 5-year survival rate for patients who had the total thymectomy was 67%. Not bad. But for those who had just the partial procedure, it dropped all the way down to 30%. I mean, look at that difference. The evidence here is just undeniable.
And that brings us to the bottom line. The research makes it crystal clear. Total thymectomy is, and I'm quoting here, oncologically superior. In plain English, from a cancer-fighting perspective, it's just a much, much better approach. It's not just a better option, it's really the only safe bet when there's any doubt at all. So in this particular high-stakes gamble, going bigger is without a doubt safer.
Okay, so we just saw how data can completely flip a major surgical strategy on its head. Now, let's shift gears and see how data can fine-tune one of the most common procedures out there, the appendectomy. It all comes down to one simple measurement that can lead to a much safer outcome. The magic variable we're talking about is called subcutaneous fat thickness, or SFT for short. And yeah, it's exactly what it sounds like, just a measurement of the layer of fat right under the skin. It seems so simple, but it turns out this one little detail is an incredibly powerful predictor of post-op infections. So check this out. A huge meta-analysis dug into the numbers and found that for patients with a high SFT who undergo a traditional open appendectomy, their risk of a surgical site infection shoots up by 1.82 times. That's almost double the risk just because of that single measurement. That's a big deal. But now, watch this. What happens if you just change the surgical approach? For patients with the exact same high SFT, if they get a laparoscopic or keyhole appendectomy instead, the risk increase is only 1.09x. That's so small it's not even statistically significant. The surgical approach basically cancels out the risk. So what does this all mean? It gives surgeons a really elegant, simple, data-driven game plan. Step 1. You measure the patient's SFT before you even go into the OR. Step 2, if that number is high, boom, you've identified an elevated risk for infection. And that leads you right to step 3. Choose the laparoscopic approach. It's a clear, actionable way to personalize the surgery and make it safer for that specific patient.
All right, for our last topic, we're taking a big leap into what feels like science fiction. But I promise you, this is real, and it's already showing incredible results in preclinical studies. We're talking about an on-demand 3D printer for bone. They're calling it the bone glue gun, and it's a handheld 3D printer that allows a surgeon to literally print a scaffold to repair bone right inside the patient's body. The process itself is surprisingly straightforward. You load a cartridge with a special bioink, you heat it up, but only to a low tissue-safe temperature, and then you just print. You create a perfect, custom-fit scaffold right inside the defect. So you're probably wondering, what's in this magic bioink? Well, it's a really smart cocktail of materials. The foundation is something called polycaprolactone, or PCL. It's a biodegradable material that the body can just safely absorb over time. Then they mix in hydroxyapatite, which is the same mineral that's in our actual bones, to give it strength and encourage new bone to grow. And here's the brilliant part, they can even load it up with antibiotics that get released over time to prevent infection right at the site. It's amazing. And this isn't just an idea on a drawing board. They've tested this in rabbit models with what are called critical-sized defects. Basically, these are gaps in the bone that are so big they just can't heal on their own. And the results? They were incredible. The 3D printed scaffold triggered the growth of new, stable bone that blended seamlessly with the rabbit's existing bone. It just worked perfectly. So let's take a step back. When you look at these three stories together, the thymus gambol, the smart appendectomy, and this bone glue gun, you start to see a really clear picture of what it means to be a modern surgeon. It's pretty clear the modern surgeon's toolkit is about so much more than just a sharper scalpel or a fancier robot. It's really about three things: using data to challenge old assumptions, personalizing surgery based on the individual patient, and embracing groundbreaking technology that creates custom solutions right there in the operating room. And again, this whole briefing was based on a profound review by Dr. Reza Linkarni. If you want to dive deeper into any of these topics, you can access more details through the Surgical Pioneering podcast series application. The link is right there on your screen. Thanks so much for watching.